Welcome back to the We Got This podcast here with WeGotThis.org. My name is Elissa Kalver. I am the founder and CEO and metastatic breast cancer thriver myself. We're so excited to have this podcast, which is really just a way for our community to have additional resources and people that they can hear from of the things that might be in need most. And so that is why today I'm so excited to have Sarah Clark here, who is Executive Director for Blood Cancer United, formerly Leukemia Lymphoma Society. And I will let you kind of dive into that, Sarah, so we say it all correctly. But I'm so excited to dive in and how you've been a part of this world for me well before having cancer myself. And now very much while I do too.
I love it. Yes. Oh, so my background is not always been in nonprofit. I was in sales many, many moons ago, which is really the same thing as fundraising. So it all makes sense. Now I just get to do sales for a good cause, which is really awesome. But I got into nonprofit because I was a stay-at-home mom in between my professional career and doing what I do at in nonprofit. And I learned how to be a serial fundraiser, and that it was so much fun to work with volunteers and to raise money for a cause, and that it's not scary to ask for things when you're asking for other people, which is what brought me to Blood Cancer United. I have a personal mission connection to Blood Cancer United's mission. I have a cousin who's a leukemia survivor he's a miracle. He should not still be alive with us when his chances of survival from leukemia in the 70s were below 10%. And he's still with us. And then sadly, I have an aunt who passed away from leukemia in the 80s. And so this mission means a lot to me. I worked here for 15 years in so many different capacities. And the way that I got to meet Elissa was working in our team and training campaign and being a manager for a marathon team and then a cycle team that both she and Eric were on. And I absolutely loved it. It was such an incredible way to be in the community and see people doing wonderful things for us and raising money. And so, yeah, that's kind of where we got to today. And I love that we got this mission as well, because we're like sister organizations, right? We all care about people who are battling cancer. We want to help them in any way that we can. So we do it one way with research, advocacy, and patient support. And We Got This does it in their way to make sure that patients have everything that they need at their fingertips and that people can get it and help them with it. So yeah, we work really well together.
Yes, I couldn't agree more. And you were one of the first calls I made when I had the idea for We Got This, of being like, this is what I think like I've needed since being diagnosed in all of your years in this world. Would you agree? And you were like, please do this. And I remember that conversation. And so I'm so grateful now that you're on our board and all of these great things. But, my initial experience in the nonprofit world was doing team and training and races for LLS and learning about all the resources that were available that I think a lot of people still might not even realize, like within your system. I mean, I know things like the 800 number and other stuff that I remember Matt Krinsky was like, make sure people really know that it's not just like an 800 number. Like it is like, there's a real person there, like answering
Yeah.
those questions. So that'd be great for people to know about some of those resources if there's things that you want to make sure people know about Blood Cancer United that they might not know about.
Yeah, no, absolutely. Our patient services support is like beyond no other. I mean, I have to say, I had a coworker who had pancreatic cancer 2 years ago, and as she was struggling toward the end of her life with options, I called every single nonprofit I could think of that had a connection to either pancreatic cancer or just cancer in general. And the services we offer, I couldn't find anywhere else. And that was heartening to know that we do wonderful things for blood cancer patients, but heartbreaking to know that there are patients out there who still need those kinds of services. And so when we talk about our patient outreach, it's like you said, that 800 number, the reason it's 800 number, I always feel like I need to tell people, is so that it's accessible to everybody, not because it's impersonal or it's
Yeah.
like some random people are going to answer that phone. It is trained nurse practitioners and social workers who are answering those phones, who are helping, that are experts in every disease state and under blood cancer, and can really help you get educated on not just your disease, but like nutrition. What should you be eating through your treatment? Do you need a clinical trial? And if so, can we help you find it? We have nurse practitioners who follow cases, although sometimes it takes 6 to 8 months to help a patient working with their care team to get them into the right clinical trial. And then we have financial support, of course, is what always people think of for nonprofits that can help with, but there's a
Mhm.
ton. There's travel assistance if you need to travel to that clinical trial. There's just straight up hardship, support if you are in a
Yeah.
situation where you just need to pay bills. There's copay assistance. So there's a lot of different financial help that we can give, but also I think the more important is like the psychosocial support that happens, because we have an amazing program called the First Connection program, where patients who come to us with a specific disease can get connected to a patient that's been through this before, who's on the other side. We try to keep the demographics the same, like age, sex, that sort of thing. Even try to keep them in the same part of the country. That's not always easy. But so that somebody can give them hope, right? If somebody can see somebody else can get through this or can live a thriving life in the same situation, they have hope, and that changes their course in a lot of ways. Elissa, you and I have a mutual friend, Jamie Alamio, who,
Yeah.
sadly was paralyzed by his multiple myeloma. What a scary thing to have your first symptom of cancer be you're paralyzed. And we were able to connect him with another patient, and he was told he's never going to walk again, right, by the doctors. But he was connected to a patient of ours who was in the exact same situation, who was walking, who overcame, and it gave him hope. And that's why he's not only walking, but doing crazy endurance things with his body all the
Yeah.
time to prove
I
to the
mean,
world that he can
the
do it.
fact that Jamie's done so many races beyond what I've done with him, but the 100-mile bike ride I did around Lake Tahoe, the marathons I did, the triathlon I did in Hawaii, like, I did that alongside Jamie, who was told he was never gonna walk again, and those are the scenarios where it's like it's a constant balance, I think, of making sure that we're realistic and, like, don't feel like we're underachieving if we're patients who that does because that doesn't happen to everyone, right? But also knowing that, like, we don't have to lower the bar because we have cancer either. We should be able to, like, set those expectations and meet ourselves where we're at, regardless of what that is, and I think that's what orgs, like, what we're so passionate about doing, make possible.
Yeah.
And then bring people to. Jamie has been advocating for so many years and has raised so much money towards research and things, and, we're gonna have to send this to Jamie, he's gonna have to listen. We'll probably have to
I
have him on the
know.
podcast.
I know we're
Yeah.
bragging about him because he's someone to brag about. He's amazing.
Totally. Yeah,
Yeah.
absolutely. And I think that's a great transition too into, a big piece that I saw so when I started We Got This, the main thing was this gift registry because I was like, why is it so easy to like ask or receive help when we're pregnant or getting married? And then when I actually faced the cancer diagnosis myself, 4.5 years ago, I was like, okay, this is actually really complicated and it's an unintentional burden, and I've said a lot of the things that I'm kind of asking people not to ask, but I don't know. I need to give them a solution if I'm gonna say
Mhm.
that. So we started the gift registry, and another piece that came up so much was like, one, what do I register for? So, like recommendations and that, which I kind of interpret as our community, like getting
Mhm.
people like me and Jamie to give tips and advice on what we might need. But then the other aspect of our resource directory, which we recently launched months ago, of having other nonprofits like Blood Cancer United, and we have hundreds on there already, and there are so many more to be done. But I think, what Blood Cancer United has done such a great job of is all the things you said, like, it's all in one place, but, and it switched from Leukemia Lymphoma Society to Blood Cancer United for this reason, right? To make it all-encompassing of all blood cancers, and where I kinda saw We Got This and where I do see We Got This is, like, how can we do essentially that, but for everyone going through all types of cancer and everyone affected by cancer, so the
Mhm.
caregivers and the people supporting and all of that also. And it's a tall order, as you know from helping out, but I think what's become so, like, apparent to me, which I think might not be as apparent to people like, you get it, but not everyone who's been in the nonprofit space forever might understand this, of, like, we can all work together in such amazing ways. And so that's why I've prioritized some of our funding and our bandwidth and time in this directory. So, like onwegotthis.org, if you go to the resource directory, you'll see Blood Cancer United, you'll see tons of hundreds of other nonprofits. But the part I thought was so important was to be able to filter by like financial need or support, retreats, like what you're going through and all of that. Um, and so, of course, Blood Cancer United, for someone that falls in that category, it's like a great, I mean, you have all of that within it. And
Mhm.
so I think there's, to anyone listening who might have blood cancer, they might have another type or anything else, like as a holistic way of looking at getting the support you need. What have you seen of like, I'm sure you get plenty of friends and people, especially in the work that we do, who are like, my friend just got diagnosed. What kind of things have you found most helpful to recommend people to?
Yeah, I think the most helpful really is, again, we got this above and beyond us because I think there's such an incredible need. And you said it perfectly. When you're having a baby, you're getting married, people are okay with like, hey, this is what we need. You
Mm,
don't do that when trauma hits, no matter what it is, whether it's cancer or something else. And
yeah.
so, and I think the other hard part is, as the person going through it, you don't wanna ask for help, it's very uncomfortable, but the on the flip side, it's even more necessary for people in your world to be able to help you. Because even more than when the good things are happening, when the bad things are happening, people feel also out of control. Even the people who are next to you or 2 degrees of separation from you, they feel out of control and they want to do something, and the person who's usually going through it is pushing them back like, "No, I'm fine, I can deal with this." And this is a beautiful, easy lift way that someone can ask for help without asking, right? They can say, "Oh, well, if you're wondering, you can always go here." And you can help by looking at resources or a registry that I've set up. It makes it 1,000 times easier for people because the last thing you need to do is step out of your comfort zone when you're already going through trauma, and stepping out of your comfort zone by asking for help, right? So I think that's a huge place. And for us, I mean, it's literally connecting them directly with our information resource center immediately because I think that like their scope is so huge and the things that they can do. And even locally, sometimes there are things that we can do to help because we just have local connections for things. I
Yeah.
remember a few years ago, we had a family who was living out in Lancaster, which is, several hour drive in traffic to get into the city to get to their treatment for their child. And they were struggling with a place to stay. They were struggling with like a stroller. Like they just couldn't afford it because of all of the cost of their cancer treatment. And because we just locally were able to get together and we got up a collection to buy them a stroller. We knew somebody who owned a building close to where they were getting treatment and said like, "Hey, is there a way for them to get an apartment for a month that we'll pay for?" That they can. So it's just like you never know what the resources are. That's not listed on our list of things we can do for people, but we try to take it on a case by case basis and help and figure out where can we make the biggest difference for this family right now and take the biggest burden from them. So I think that's the people are just look sometimes it's not huge the help that they need. Sometimes it's just a kind word. I met a woman on Saturday. We had a blood cancer conference and she just needed to be heard. She's like, this just felt so good. Thank you for listening to my story. And this is all I needed was someone to listen to me and what I'm going through. And that was it. So there's a full spectrum of what people need in those moments.
Exactly what you just explained to me is also that can be on a grand scale, like Blood Cancer United, but that can also be like the friend who doesn't know what to do. I think we underestimate sometimes, like, I think about this a lot with financial toxicity and everything, which is a huge thing in the cancer community.
Yes.
But a lot of times, I think, like in what I experienced, because my insurance was covering everything, I just didn't have the right team at first.
Right.
And so what I needed wasn't actually like, that didn't matter how much money I had, right? That mattered who I knew.
Yes.
And that really came down to, like, utilizing your network. And I think that the more that we normalize being able to share what we're going through, like, and we're in more of a generation and a time now of social media and other things. I mean, there are definitely everyone's different, I'm
Mhm.
literally an open book, whereas some might be more private about it. But whichever setting you're comfortable in, I think that what our orgs really try to do is like make people feel comfortable to reach out and to feel like they can build a community and have people who understand because I always like and I can empathize with people not wanting to be too open, but then I feel so, helpless, and I feel bad for what they might be missing out on because of not
Mhm.
having the people know, and that's where I feel like it just puts more of that, um, importance on more people knowing, like, that our site and our resources and community partners and stuff exist. Because you don't need to, like, be all out for everyone to know about it, you just need to know where to go, and you might not have the person telling you because they might not know you have cancer.
Yes.
Um,
Yeah.
yeah,
That's huge. I feel like it's like my biggest struggle is when I meet somebody and they tell me like 3 years ago I went through treatment and all these things happened to me, and then my next question is always, "Did you know about us? Did you call us?" And if they say no, I'm like, "Ah, it's why we work so hard. It's why we raise so much money is so that people can have that support." And it breaks my heart when they go through it alone. So yeah, it's the most important thing that we do is connecting and making their lives better and easier. And sometimes it's a conversation. Sometimes they need us for a long time and for everything. You just never know. Yeah. And speaking of financial toxicity, I don't know if I even told you about this, but like 18 months ago, we started a medical debt counseling service at our IRC, also an information resource. That's the 800 number. And it's pretty amazing. So far, they've saved over $6 million for people in the last 18 months. And that's
that's
just like looking
amazing.
at their bills saying, hey, like you need to go back to your insurance and negotiate this. We don't pay it, but we're working with them to say, to basically give them like a download of what it actually all means and saying like, no, go back to the hospital. They should have paid for this, or no, insurance should be paying for this. Or no, this is actually what your bill is, because it's so confusing to deal with that. So just to have that support and another human who can walk you through that completely new language that people have to learn. It's like, oh, it's not enough that you should go through trauma and be diagnosed with cancer, but now you have an entire different language that you need to learn, both financially and cancer wise, right?
And most of it, like, it's so great to have those tangible numbers that you're mentioning, like, already from the past 18 months, because most of it is people not having the bandwidth or knowledge or energy to fight it or to ask more questions, and I get that because like, I'm here running a nonprofit, but I still, like I'm actually navigating, Medicare right now. I had to pay out of pocket 20% of my infusion, last week, which luckily is Herceptin right now, which isn't like it's not tens of thousands or hundreds of thousands, but it's still, it was money I had to put out of pocket because there were things I didn't know, like,
Yep.
because 'cause I'm not a Medicare expert, and these things, and so figuring out, I feel like that's a big part of so first off, for people listening, for
Mhm.
all the like, the 800 number that you described, what are the requirements for that? Like, is it that you
Honestly, you just have to have a blood cancer or be a caregiver for somebody with a blood cancer. And honestly, that's not always even true. It can be any cancer if you're calling about nutrition. Our nutrition services are open to anybody that has cancer. So that's really important to know. Yeah. And honestly, even if you're not sure, you can just call us. It's okay. They'll talk you through it. Nobody's gonna be like, you're not allowed. So it's not that at all. So yeah, it's a beautiful experience and ability for people to just like take some stress off of themselves to get some answers. Because think about it too. A lot of times you're meeting with your own doctor, your own nurses who don't have unlimited time to spend with you. You may have questions that don't get answered in a regular doctor's appointment, and you just need to talk through it. Or you get an answer you don't understand and you didn't realize it till you got home. You can still call us and we'll talk you through it.
Yeah, yeah, I love that. So basically, anyone with cancer that wants nutrition advice, Blood Cancer United, you can call the 800 number, you can go on the website and have that resource. And then anyone with a blood cancer or who's caregiving for someone with a blood cancer, I mean, there's then just a slew of other things that is focused on,
Yes.
and at your disposal. And then, for people who need those additional things and don't know where to go, that's where if you go to wegotthis.org and on the resource directory, you can filter by those individual things. Triage Cancer comes to mind for other types of legal advice and support through treatment. There are just so many, and there's so many more that even through the past 4.5 years of being a patient and being in the nonprofit space, I mean, there's just so many out there. I think, like, part of my life's mission with all of this is to aggregate it more. Like, I do feel like, I think you guys are such a great example of, like, doing all the things for a specific group, which, like, doesn't exist in a lot of other cancers. You know, I
Mhm.
even say from a breast cancer perspective, I mean, we're probably the most marketed cancer there is, and there's a
Mhm.
lot of resources, and I always like to attribute it to that, like, you know, there's definitely male breast cancer. Shout out to my friend Jake, who's the guy with stage 4 breast cancer. They still make up 1% of it too. But like when you have all of these mission driven, badass women whose bodies tried to murder them, like you get a lot of people who want to make an impact and a difference. And there's so many
Mhm.
great organizations that have been started. But like being the hub to make sure everyone knows all the things available to them, whether it's nationwide or local, is something that I think in the nonprofit space we've lacked. Because it's tough, like, and who
Mhm.
pause to do that? We're all working and we're all, you know, trying to fundraise to make our budgets and all these things, and so that's the piece that I hope the resource directory, you know, is already helping to resolve and just continues to evolve to, because I think it helps everyone for us to share resources. We did something, with the LA fires last fall. We used our gift registry to be able to
Oh,
raise
yeah.
directly for patients affected by the fires in LA. And we ended up raising like over $10,000. So we did some micro grants. We distributed air purifiers, which ended up all getting donated. So we didn't have to dip into the funding for that. Um, and then we partnered with We Are Ocean, which is out of the Newport Aquatic Center, on doing a retreat. Because I was like, with 10 grand, I mean, we can't rebuild someone's house, right? So
Right.
let's do something that focuses on quality of life and mental health and, you know, kind of coming out of this crazy time that like everyone in LA experienced. And then there's a subset of us who experienced that while going through cancer. Like I couldn't go to my PET scan, and actually, my oncologist was arguing with my insurance to get me my PET scan covered. Mind you, I have stage 4 cancer actively in treatment, and I was having to switch because I had a recurrence at the time. And so I'm like, I don't know what it is yet, but I know that we have specific needs. So we're going to need, and everyone was asking who they could give to. So we ended up partnering with We Are Ocean on doing a retreat on Catalina Island for like a dozen cancer patients. And it was such a magical experience. And we're going to do it again this year too. But like, you know, not reinventing the wheel every time. It was like, if I took that 10 grand and it costs more, We Are Ocean spent way more to do their program and we appreciate it so much. But like, if I took that 10 grand and tried to create a retreat, I would have been able to do far less for people. Cause like,
Right.
you can't just go into a lane you've never been in and then like execute something for a fraction of
Mhm.
what it costs to execute. And so by partnering up with them, like we were a partner and we brought in the community of ours branched with theirs and we created something so much bigger than what we could have done individually. And so that's like one example, but I think that we could be doing that all over the place. And I hope that we get to more.
Yeah, I agree. I feel like a lot of nonprofits, especially in the cancer space, have been doing that better on the research side,
Yes.
especially ever since President Biden, the Moonshot Initiative. You know, they're all coming into one room. I know our CEO was in that room, making sure that we're talking because before the moonshot, I remember our CEO, Dr. Lou De Janeiro, saying, if we could all just work together, this would go so much faster. So thank goodness that was something that brought it together. But you're doing something that's bringing people together that's on this, you know, on the same level, just in the patient services. Like, how do we help people in real time when they're in need, and we should all work together. Because there are certain nonprofits that are, like I said, sister organizations. You know, we're also a sister organization with what used to be called Be the Match. Forgive me, I forget their acronym
Oh, yeah.
now, but we work very closely with them because our, you know, our audience and their audience are very similar. We can help each other. You can be doing, you know, swabbing events and getting people registered for bone marrow and stem cell transplants in our audience, and we can talk to your audience about making sure that they know about our services, so we can help each other with those things in this place that we're not in competition at all.
Yeah, yeah, it should always be collaboration, not competition, and, you know, when you think about, like, when you're mentioning moonshine and all that, I mean, that's pretty recent, like, so when you think about how long it took for more orgs to come together for research, which is always gonna be, you know, and that's why I'm alive, right?
Mhm.
But, the other piece that I always say, it's like there's 2 main pieces to living with cancer, and It's, the survival part, the research side, and the medicine, and us staying alive, and then equally as important is us being able to live and thrive and, with whatever we're all so different and our experiences are so different. And I think what's really positive about the patient services side and the joy living life side is that while I think that they're equally as important, one costs way less than the other. Like, research is way more expensive
Yes.
than us being able to do what we're doing, and so I always try to say to people, like, from a fundraising perspective, it's like, if we could just get, like, a carved out section of this, I mean, we don't need millions and millions of dollars, you know? We
Mhm.
just need to be able to create more of this space, but I think that, by continuing to bring people together in that sense, and I think that's actually a great example, which I hadn't really thought of on the other side of it, that people can relate to coming together on. It's like not everyone needs to create we definitely need more than one for like we can't have one company doing all the retreats for every
Right.
type of cancer nationwide, right? Or globally. But but there are ways that we can, like, support each other so that not everyone is spending on like, we don't all need a different resource page. Like, my hope is that we created and invested more time and asset, and money into this resource directory that I don't know if I've never seen a resource directory that can filter, which I mean, I have no tech backgrounds, right? I mean, we have help and developers and stuff, but, like, it's hard for a nonprofit to pause from whatever else they're doing in their mission or allocate
Mhm.
resources to doing that, and so I get it. But on the flip side, it's like we're in a time now where marketing does matter a lot, not just for fundraising, it matters that people know that these resources exist. And
Yes.
so because that's not a traditional thing that people wanna fund, I found myself being very scrappy with that and resourceful in doing it, the ways that we can figure out how. But I really think that that's, like, such a big piece of this is creating that in one space for people to have, but then also people need to know it exists. So the more that we partner together and expand it out to our communities, like, the more that everyone can just find everything that they need.
Yeah, and we talk to our volunteers a lot about that and how powerful they are in whenever they are fundraising for us or out in the community as advocates,
Yeah,
that's a huge piece of what they're doing. They're making sure that their community knows that we're here. So yes, you might be fundraising, but you're also in fundraising. You're a mini marketer for us. You're telling our story and you're making sure that all of your neighbors and anybody within earshot of you knows. And so on top of our traditional, marketing that we do, that's huge. It's huge.
totally. Yeah, yeah. Yeah, that reminds me a lot of, like, how we did Cancer is a Joke or we did Not Dead Yet Fest a while ago. Like, those are things that I consider, like, a program and a fundraiser at the same time. Um,
Yes.
I think one thing that's hard for me as a patient and founding a nonprofit is, like, how we get across to our audience, like, I don't want to be posting a lot about fundraising 'cause a lot of our audience are people who need the support, not who I'm looking to, help us raise money through. But then also making it so that, like, anyone listening or anyone going on the site or feeling inclined in certain ways, like, has options to do that. Because I also know that in my 5th round of chemo, like, when I came up with this idea for We Got This, like, this is the therapy for me. Like, this is something that I made sure didn't already exist. I didn't wanna duplicate efforts or, like, reinvent the
Yeah.
wheel. And so when I realized it didn't exist, and it was a problem and gap that I saw, like, the idea of just making sure that we're getting to fulfill, like, our passion and what we feel so strongly about and align with, while also getting to make the biggest impact possible. So, I know, it comes up a lot, and I always joke, like, you don't have to start a nonprofit in the middle of chemo, like, that's not the expectation I'm trying to set. The idea is that whatever fills your cup, like, you should focus on that alongside treatment because that's important too. And so
Very
yeah.
important. It feels like and I talk about this a lot with volunteers too. It's like it's giving somebody the opportunity to feel like they have a little bit more control, about whatever it is that they're going through, right? So it's like an opportunity to say like, "Oh, if you raise a couple $100 for something," it's like, "Oh, I'm also giving back at the same time I'm receiving," and that's a beautiful thing, and it makes people feel whole again in that moment.
Totally,
Um,
yeah.
And then being able to come to events, like Cancer is a Joke, and spend time laughing when it's hard to laugh in those moments. You know what I mean? Or know that you're not alone because you have a whole community of people who are either in the room or supporting to be able to make something like that happen for you. And I think that's just, again, it's invaluable, that sense of belonging and community for people, because you immediately feel alone, I think, when you hear a diagnosis, you know?
Yeah. Well, and that, like, stood out to me so much when I was diagnosed because my main philanthropic experience was all with LLS and team in training. And, I had, Randy, our friend Randy Kalver, who showed up with Shishi, who's now, like, a really good friend and had since ended up getting diagnosed with cancer herself and is a badass survivor. But, the day before treatment or something, I walked outside and, Erica coordinated with Randy, and they had decorated our whole driveway with chalk and all of that, and like, the amount of people from Team in Training who are still involved, like, who ran the LA Half Marathon for us the past few
Mhm.
years yesterday, and all these things that overlap that, like, yes, even like we talked from the beginning, like, Blood Cancer United exists, for the blood cancer space, but, like, me, as someone who had been on Team in Training and a part of that space, and mainly because of Eric's mom, my mother-in-law is, I think 12 years now, stage 4 lymphoma survivor, which is so amazing, and some of the drugs she's had, like Cytoxin and other stuff, LLS
Mhm.
Cancer United has funded, and the second I was diagnosed with breast cancer, I still had the blood cancer community, like, having my back, Jamie Alamillo is still one of my first calls and, like, all these people, and so I think that's something that's just, like, so powerful across all things is, like, you just experience a different level of understanding and grief and things that come along with being in this world, and I already felt so drawn to it years ago when we initially met, and then it's really amazing to, like, think about that when I needed it myself, like, it was right there, and so I think that's what everyone deserves, like, nobody should have to go through any of this alone, whether you're the patient or you're in Eric's position as the husband and the caregiver and other things too.
Yeah, it just made me aware. I was talking to a doctor from UCLA on Friday morning, and she was telling me that she turns away, speaking of meeting your people, she has to turn away at least one patient a week from certain treatments because they don't have a caregiver to take care of them. And the treatment, it's just like if you can't have a colonoscopy, if you don't have somebody to drive you home, it's the same thing. It's like there are certain things that have to be outpatient, and they cannot give it to a patient if they don't have a caregiver. And how heartbreaking is that? That you are already going through a trauma, you're already dealing with illness, and then salt in the wound. It's already hard to go through this without a caregiver, but you also can't get certain treatments because of it. And that's a huge need that needs to be filled. And she brought it to me because she was like, how do we do this? We don't actually have a program at Blood Cancer United yet that will help with that. So we need to
Yeah,
figure
some
it out.
ideas. We could be
Mhm.
my wheels are spinning.
Yeah, so we need solutions when we find these holes in the system that we need to be able to fill, and that's what nonprofits do. We fill in the holes where we need to.
Yeah, uh, that's such a great example of, like, being in the trenches of all of this and hearing in real time where the real issues are, because, when I first started this, I'm like, "I can't help everyone everywhere," right? So, initially, I'm like, "Well, I'll help breast cancer in LA," and then I started being like, "But why not? Why can't we help everyone everywhere?" And that's when I, dug a bit deeper, and I don't have a tech background myself, but reached out to people who do. And you start realizing, like, no, like, there are ways that as we identify this stuff, like, and the more we know that's out there and the more that our community knows what's out there, they can see that too. And I think that not only in the part of finding what you need, which is so important, and that's why we're continuing working on that, but also in, like, that fill your cup aspect. Like, it might be through the help that you got during your treatment that's then where your mission lies, and stuff that
Mhm.
opens your eyes up to things that you never would have known were a component of this experience otherwise.
Yeah, absolutely, absolutely. Yeah, it's endless. People need us.
Yeah, absolutely. And so anyone watching, Sarah's amazing. She's located out here in LA with me. Obviously Blood Cancer United, formerly Leukemia Lymphoma Society, for those who haven't gotten the memo yet, um, has so many amazing resources. You can find them on wegotthis.org in our resource directory. Obviously, you can go to, is it still, what's the website now?
It's bloodcancerunited.org.
Okay, cool.
So super
Um,
easy.
Yeah, and same with that 800 number we were talking about early on. And, we'll put all that info in the notes and things like that, but as people are hearing this, if they like, things spark to mind and all of that, you can always email us directly at info@wegotthis.org. We're always excited to hear about other resources and opportunities that people should know about, and just keep giving us feedback and letting us know how we can best help, 'cause I feel like what we're kinda doing, I mean, I always use this analogy of, like, we're building the plane as we fly it, um,
We're
and
76 years old, and we still say the same thing because
yeah,
new things are happening all the time.
exactly, and I think that's, like, very indicative of how it is being in treatment too, because you 'cause you're building your community as you're going through it. You don't
Mhm.
have the, and I don't even know if this would be a luxury necessarily, because it would be stressful to know, but, like, you don't have, like, a 3 to 6-month foresight that you're gonna get diagnosed with cancer. Like, you get diagnosed, your world changes instantly, and I had this out from a meeting earlier. This was my original, printout of resources when I was diagnosed.
Oh my gosh.
Yeah. Of course, it's pink because I have breast cancer.
Mhm. That's how.
Yeah,
Um,
Eric was like, "I bet that's not why it's pink." I was like, "It is 100% why it is pink. Why would anyone take the effort to do pink copy paper?" But I've actually never read it. I have it, I've saved onto it. But I received this when it was the appointment that I knew I had breast cancer already. I'd already gotten the call about my biopsies, but it was the appointment when I saw my PET scan and I found out that I was stage
mm,
4. And so when I was handed this and a folder of other information and stuff in my treatment, Eric was hyperventilating into a paper bag. He basically, like, passed out. They're, like, handing me this, and, they're doing the best they can, but, like,
yeah.
and I just thought, like, this needs to be better. Like, it just, and also, like, a lot of the pieces too, it is hard for the hospital to have that on them, because think about, like, this is specific to breast cancer, and then,
Right.
depending on what people are getting and your age and all of that, and then the adolescent, young adult community is a whole other aspect. Like, I always joke I was diagnosed at 34, I'm 38 now. So, I'm a young adult in cancer, but I'm geriatric if it was, at my
A
OB.
pregnancy? Yeah, exactly.
And so you're instantly thrown into so many things, and so I think the more that can be done to bring that together, and the more that we can hear too of, like, because I'm pulling from my experience, and that's one, and then all the
Mhm.
people along the way who have weighed in, but having the feedback and all of that, and even from other patients, but also from other orgs, like us being able to spend the time, and we do the like collaborative calls with Stupid Cancer and Teen Cancer America and other stuff. I know we're all on, and it's like, we can't fix everything fast enough. Unfortunately, it's like, I think we all, if we could, would just instantly do so much stuff. We had all the money to do it.
Yes.
But, yeah, it's for anyone listening, the resource aspect and knowing what you have at your disposal that is free, that also, like, even things being free, even with all the money in the world, you still have to have the bandwidth to figure a lot of this stuff out. So making it as easy as we possibly can is the goal, and hopefully we've started chipping away at that with the resource directory and other things that we keep keep doing of the daily grind.
Absolutely, absolutely.
Yeah. Any other, things you wanna make sure people know to follow and things like that for socials and other stuff?
I think, well, for Blood Cancer United, we're on LinkedIn, we're on all the major socials. We've got X, we've got Instagram, so and we're just at Blood Cancer United. You can find us on Facebook everywhere. It's great to follow. We share stories, we share resources, to make sure everybody understands what's available to them, and breakthroughs that are happening, so that they can learn that good news as well. So yeah, follow us on all the socials.
Awesome. Anything we didn't touch upon that you wanna make sure everyone hears about?
I don't think so. I don't think so. Just so grateful to be able to be on here and spread the word of both We Got This and Blood Cancer United, because I think like we've been saying the whole time, it's just we're here for people. You need to find your people when you need them. And sometimes those people are different people when you get diagnosed. And, this is a place where you can find your people, is both of these organizations. So
Well, I love that, and that's the perfect note to end on, and, I'm just so grateful for you, all you do for the cancer community. Like I said, I felt that before having cancer myself, and, have a whole different angle of the view and appreciation now that I do. But it's just, this is great, and I'm so glad we got to do this together, and we get to continue. I mean, I really feel like the biggest benefit, selfishly, of you being on the board is, like, I get to see you and talk to you so much more.
I know, because I miss you. We used to see each other most weekends when you like
I
before going on
know.
your very long ride. And it's like it's so fun to connect again just as humans. And also to get to meet your perfect little cherub of a child who is like the cutest thing I've ever seen. And probably the reason I follow your TikTok like crazy. I just want to see her face doing the sweetest things.
I mean, that's all I really wanna see too, so Oh, awesome. Well, thank you so much for being here. Thank you everyone for listening. If there's anything, like I said, in particular that resonated or questions that you have, info@wegotthis.org is our direct email. You can find us across all social media platforms at wegotthis.org. You can find my personal stuff as well, just at Elissa Kalver anywhere. And we're just here for all of you, and together we got this. That's the whole plan.
We got this.